Hi, my name's Julia Leffler, and I'm the co-founder and executive director of the MOG Project. We hope you've enjoyed MOGAD Awareness Month and all the great content and the contributions from our community. Many thanks to the MOGAD community for supporting and driving this month's activities. So as we come to the close of MOGAD Awareness Month, we put together a short presentation sponsored by UCB to bring messages of hope and the importance of the flock. You'll hear from MOG Squad volunteers, members of our Medical Advisory Council, industry partners, and some of our rare disease partner organizations. And we hope you really enjoy this video.
The people that are behind that name, they're genuine, they're here to help patients, they're here to put patients together with experts.
They understand me, they understand all patients, they're kind, caring. They do absolutely anything to get the latest research out to the MOG community. They're helpful.
It's just so nice to be able to talk to people and listen to what their story is, because everyone has a different story. I'm a caregiver to my daughter who has NMO, and we're all part of the same patient community. It's a very close community of people who, when they're walking into the room together, just immediately understand one another.
When my son was diagnosed, it shattered our world and turned my entire professional life upside down. They offer a place of community, a place of support, and a place of comfort.
The MOG Project connects me not only with a community of others that have MOG, but also with these top researchers and medical providers. So we become almost like a family.
So many of my best friends now are people I've met through the MOG Project, and not only peers that I've met, but doctors, researchers, nurses, physical therapists, people who are so involved in the care of MOG patients.
They constantly collaborate with national and international doctors to try and accelerate research in MOGAD, bring the latest podcasts to them so patients can really understand MOGAD. And that is the most amazing thing about this team.
We're in the laboratory lists of hours, looking at patient charts, at clinical samples, but actually getting a chance to talk to patients who actually have disease process and see the impact of what we do on their care is really what kind of drives us.
We see patients at one particular time point, and so understanding all of the nuances and winding roads to get to diagnosis and treatment, it's been very revealing to me.
What I've loved about being such a part of the community is what I get to bring to these conversations with doctors.
Everything ultimately boils down to what does the patient need. The MOG Project allows us to truly glean what the patient is thinking about their disease process, their treatment, their outcomes.
The MOG Project is always willing to collaborate with us and actually, get things done and really do the best for patients that they can.
We bring our resources together to help the patients. When I get a call from a MOG patient, the first thing I do is connect them with the MOG Project, and we work together well. We're community partners.
It's just been nice to really feel involved and like my voice matters and like I make a difference in the research world, just really collaborating and bringing all the research together.
Diagnostic uncertainty is one of the biggest issues, and a lot of patients, whether they have MS or seronegative NMOSD, actually now have turned out to have MOGAD.
When you're diagnosed with MOG and a doctor comes in and tells you you have MOG, you just look at them and say, what is that?
I had no idea what MOG antibody disease was. And I was always the one in the conference raising my hand, asking the doctors about MOG. And they would say things like, MOG is very mild. And I said, I respectfully disagree. I'm blind.
There's so much more we're learning about MOG at this point. The information is changing frequently. And we want to make sure people have the most up-to-date information so that they can go to their doctors and be as well equipped with the knowledge that they need to be able to best advocate for their care.
We want to make sure that the medical community is well educated to ensure proper diagnosis of the patient, that they can receive proper care and management.
With rare conditions, we may be small in numbers, but coming together kind of as a unified group can really help us advance research and improve medical education to make sure that people get the correct diagnosis, and also just provide a community when you get one of these diagnoses or you get a diagnosis of MOG. You might feel alone because you've never heard of it before and have never met anyone else with it. Having a flock of people who understand kind of what you're going through is really powerful.
We are so powerful because we bring everything that we can to the MOG project, to understanding the disease, to accelerating research, to working with experts, to helping patients.
The amount of things that can be done in small diseases like this really depends on collaboration and these doctors all working together. The same is true of patients and patient organizations. I think everyone just needs to, work together to help the MOG community and to move this disease advancement forward.
We're stronger together. Every single one of us is the missing piece of a puzzle.
It's being part of the community. Being part of a flock is what gives me strength and energy to go beyond.
We believe that connections made between patients, medical professionals, researchers, and industry nurtures the environment where MOGAD cannot thrive. It increases the chance for new therapies, and it improves the lives of patients. So as MOGAD patients ourselves, we're thrilled with the results, and lives are improved.
Best thing about MOGAD is the progress that we've made in the last 10 years on understanding what it is and how to treat it.
It's just nice to have a variety of partners. We just want to keep providing hope because there is hope out there. Even though I've been knocked down time and time again, I haven't given up. I get back in the game. I know that I have to be adaptable and resilient, and I'm not going to give up the fight. I'm not going to let MOG win. It won't win.
The power of the flock. The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.
The power of the flock.